Associate Professor Tai E-Shyong is Head and Senior Consultant, Division of Endocrinology at the National University Hospital, and recipient of the Senior Clinician Scientist Award. Dr. Tai graduated from the University of Dundee with a MB CHB with commendation. He proceeded to train in internal medicine and endocrinology in the UK and Singapore before embarking on an 18-month research fellowship at the USDA Human Nutrition Research Center on Aging at Tufts University. There, he worked on the interactions between genetic and environmental factors as they pertain to hyperlipidemia and atherosclerotic risk. Dr. Tai's major research interests revolve around diabetes mellitus, dyslipidemia, and their relations with atherosclerotic disease. He is involved in several large studies examining the role of genetic and environmental factors and their interactions in the pathogenesis of these chronic disorders. He is also involved in more traditional epidemiology and has been instrumental in defining the burden of disease associated with diabetes and its associated traits in the Asia-Pacific region. Finally, he is involved in several clinical trials that examine the effects of various treatments on the modulation of cardiovascular risk factors.
At what point in your career did you choose to be an investigator?
I think I can be very clear about this. It was March 31st, 2002. Prior to that, there really was no set career path for doctors to be investigators. And it was really at that time that the Singapore General Hospital set up a scheme to pay doctors to spend most of their time doing research. And because I had always wanted to do research, I felt I was obliged to take up the scheme when it first became available. So that's exactly when it was. It was an opportunity.
At the point you made your decision, how adequate did you feel?
I think if I'm honest about it, I believe I felt I was adequately prepared when I made the decision. It wasn't until I actually started to do the job that I realized how many new skills I had to acquire if I was going to be successful in this career. And to this day, I think I continue to acquire some of those skills. It's been a continuous learning journey.
What were the challenges you faced in the earlier part of your career?
I think there were two areas where the challenges were the greatest. The first is that medical school and my training as a physician had very poorly prepared me to plan a program, to secure budget, to recruit staff, to train them, to keep them motivated. All those organizational skills that make a project successful, I really didn't have, and I needed to acquire them very quickly. The second struggle I had was, I think, my organization had the same struggle, and that is, what was my place in the organization? What is the role of having clinician scientists in a hospital? And it's taken many years for me to come to terms with trying to understand what that is. And that's been a sort of real struggle, because it's meant that until that is clear, there's no real reason for people to follow. And after a while, it becomes a very lonely sort of existence.
How have these evolved as you rose through the ranks?
I think they've evolved in many ways. One, I think I've acquired a lot of the skills that are required, and a lot of that comes from mentorship and finding the right people to guide me as I go along. The other thing that has really evolved, at least my own thought as to what the function of clinician scientists should be in the organization, is the fact that I became a head of a division 2.5, 3 years ago now. And that immediately forced me to think about how I'm going to place my resources. And I began to realize that there are some very important things that we will gain in the health system through having clinician scientists in the system. As I began to sort of think about this and approach it from point of view of a manager who's managing resources and having to deliver clinical services at the same time as building a research program, I was forced to really think what I want out of this research program. And for many years, I'd believed that what we find from doing the research is the most important thing. So we'll discover new drugs, so that we discover new molecules or new pathways that are involved in causing disease. I think the longer I've done this, the more I realize that this is not the most important piece. And in fact, the most important piece, I can summarize it, I think, into two components. I think of this in terms of culture, and I think of this in terms of competencies. If you think about the health system today, there really is only one certainty, and that certainty is that this health system must change and evolve. We really don't know what the future is going to be, but there are a few things that I can tell you that I know need to happen. The first is that the current model of healthcare delivery is not sustainable, and it must evolve. What it will evolve into, we don't know, but we need people who are continuously challenging the boundaries and asking ourselves, how can we change the healthcare system? And if we don't have that, then we will fail. The second really is around the competencies that will allow people to do that. And if you think about education in general, and in fact in Singapore, the Ministry of Education in Singapore talks about 21st century competencies being confidence, collaboration, and creativity. How do we create that in the healthcare system when people are dealing with patients? We don't want to be experimenting when we're trying to prescribe treatment. And I think research gives you an environment, a safe harbor, where you can do things that are out of the box, that are unusual, in an environment where you're carefully measuring the outcome. So it creates that opportunity for doctors to be involved and develop the skills that they need to build a healthcare system of the future. And that, to some extent, I think is far more important than what we actually find from the individual research projects.
How do you cope with these, and who is your reference points?
There are very few reference points in Singapore, and I think that's why a lot of young clinician scientists either don't embark on a career or give it up. I've been very fortunate in having the right sort of mentors to help me cope with this. I take support from essentially two groups of people. I think about a network of peers who are going through the same things that I'm going through. And there are 4 or 5 of us who started about the same time. And we do talk to each other regularly. We try and understand each other's problems, and we do suggest solutions to each other. At the same time, I have a small support group that consists of people who are senior. Some of them are my bosses, but also people who have gone through it before. And I do have regular conversations with them, and they provide a lot of guidance as to how to get things done, where we should go with our careers. And sometimes that, even if they don't have specific advice for me, that conversation, I think, gives me perspective and helps me to make decisions about my own career development.
Who are or were your memorable partners or collaborators so far?
So when I started on this career, there are 2 people that stood out. I spent 18 months in Boston working with Professor Jose Ordovas. And with Jose, his was a relatively new lab at that time, and I joined as a research fellow, so I was fairly junior. But Jose spent 10 to 15 minutes every morning, and we'd sit down, we'd have coffee, we'd talk about what we'd done the day before, what we thought it meant, what we needed to do today. And it helped guide me through the plans for the work. And then when I came home, after that fellowship, and I was employed as a physician scientist, I worked for a head of department called Dr. Tan Chi-Eng. And Chi-Eng sat with me for 10 to 15 minutes every day, and we'd sit and have coffee, and we'd review what we'd done the day before and what we were going to do. And that kind of mentorship is incredibly valuable. And I was very lucky to be able to find people who were able to do that with me over my career.
So what gives you the buzz to continue on what you're doing?
What it is learning something new every day. I really do feel as though I learn something new every day, and I do think that what it leads me to do, to be able to do, is to have an understanding or a conceptual framework for what I do that other people don't have. And it's only possible because I'm constantly challenged to ask new questions and ask whether what I'm doing today is the correct thing.
In retrospect, what would you do differently if you go back in time?
I'm very lucky. I wouldn't do anything differently. I think every experience has shaped what I am today, and I'd do it all over again.